Christina Camilli, and I'm here with kinesiology professor Scott McLean to talk about a new study that he was the lead investigator on, talking about gender risks and ACL injury. Thanks for joining us today.
Thank you.
Professor, one of the most common type of knee injuries is to the anterior cruciate ligament, ACL. What exactly does that mean when somebody injures their ACL?
Well, the anterior cruciate ligament is like a cord that holds like the thigh bone and the shin bone together. And basically when you injure that ligament, what that means is from now on, the knee is held together by that ligament. Now the knee will move a lot more. So these injuries, when they happen, they tend to cause a lot of problems afterwards in terms of the way we move, how successfully we can keep moving along, and it also has a lot of long-term consequences such as osteoarthritis.
And with this particular study, you looked at the differences between male and female ACLs. Why did you feel that there was a need for this particular research looking at those differences?
Well, a lot of the research to this point has been done looking at the way that boys and girls move differently, which is important. And so a lot of the prevention programs have really focused on trying to teach girls and boys to move the same. But what we're doing here is looking a little bit deeper and seeing that the anatomy of the knee and the ligament itself, they're actually different between boys and girls. And if they're different, then maybe when we teach a girl to land like a boy, it isn't going to work as successfully. So by understanding differences between the ligaments themselves and in the joints themselves, it's going to help us to tailor our training programs and our injury screening to target more sex-specific risk factors. So rather than just simply looking at girls and boys being different in the way they move, we're also looking at girls and boys being different in the joints themselves and the anatomy, and that's really important.
You know, this study also made this issue of gender generic training programs, that you really need to move more towards an individual tailored program. Can you talk to me a little bit more about that?
Yep. So what we've seen is that every knee joint is very different. So the anatomy is different, the ligaments are different, and then more often than not, the way the muscles are aligned are also different. So having a fairly generic training program, while it may work for 3 or 4 people, it may not work for the next 3 or 4 because their joints are so different. So what we're trying to do here is to look at individual risk factors, and with improvements in technology and what we're doing here at the University of Michigan and the Bone and Joint Center, I think we're able now to look at that and cater towards these individual differences, because every joint may have a different type of risk, and if we simply try and train every person the same, we may not accommodate for those differences.
Speaking of looking at the different risks, I understand that there was a computer model that was part of this study.
A lot of the work, what we're sort of working towards here at the University of Michigan, is trying to develop like a clinical screening tool, like a computer model that will allow us to predict risk in each person when they come in. So our ultimate goal here is to develop a computer model where someone comes into the lab in the morning, we measure their movements, we look at their anatomy, we look at their ligaments, we feed that into the computer model, and then by the end of the day we can have some sort of understanding of how that person is at risk, what their risk is, and then what we can do for that person to prevent it. So these computer models, I think, are the way of the future, where we can actually have these clinical tools which improve the ability to screen who is at risk and also helps us to tailor our prevention to that individual person.
So I think a question on our listeners' mind and our viewers' mind might be, are we any closer to finding what causes ACL injuries?
You know, I think that's a good question, and I think as researchers we hope we are, and I really believe that we're really starting to focus on things more appropriately. We're starting to understand that this injury doesn't occur because just of the way our muscles are or just the way our bones are. I think we're getting closer because we're finally appreciating that all these things work together to cause risk. So yes, I think we are getting closer, but there's still a long way to go, both in terms of what actually causes it, but then also how do we prevent that.
To learn more about Professor McLean and the research at the Bone and Joint Injury Prevention and Rehabilitation Center, log on to our website, www.bjiprc.umich.edu.